It is 11:01, and I'd like just to welcome everybody who's joining us. And as you're joining us, we just want to welcome you for your first time or welcome you back for Bright Talent's Roadmap to Return to the Workplace. As you know, that we've been running these for a few weeks with excellent engagement from our HR community. And I just want to turn this over to Brennan, and he'll just get right into it. As you know, Brennan is our founder and president at Bright Talent, and that Bright Talent is really leads the way to solve strategic people solutions. Go ahead, Brennan.
Thanks. First, let me just share with the group, 1 minute before we were supposed to go on, I simply share my screen, which is the PowerPoint. And I had just made some updates on the PowerPoint, such as the date, says April, it's now May. And then we're moving down the path in terms of the roadmap. Unfortunately, today, Zoom made some updates and I'm unable to share my screen. So thankfully, Miki Jo has a copy, but this copy is basically 2 weeks old and in today's time frame, that's like 2 months old, it feels like. So I'm going to be just speaking to this, but some of this information might be just a touch old in terms of guidance. However, I'll give you the correct information. So really thankful you're here, really grateful you're all here. I saw some familiar names on the attendee list. So this is more like a group of friends and colleagues than a bunch of strangers. So that was great to see everybody on the list. So thank you for attending. What we've been doing, if you can believe this, Miki Jo, this is the 6th week. So this is our 6th webinar that we've been hosting. And our team, 6 weeks ago, actually 8 weeks ago, we realized we are going to return to the workplace and it's going to look very different than how we left the workplace. And then we realized this is a change management project. And so in terms of a change management project, you organize to put in new process, new policy, new communications. And it's not just for one group, it's usually the entire company. So we set out to build the roadmap to return to workplace. And it's a workforce plan, which is really a change management plan. And so we're going to jump in and we're going to go through this. And this is a bit of a do-it-yourself approach. And we have all these tools that I'm going to share with you today are on our website at brighttalent.com. And it's under the pandemic support page. You will find all these documents to download. And if you would like, you could download them now to follow along because I'm going to go through some of them. And then we'll get more detail and then we'll hand it over to Miki Jo. So today is a bit of a unique day as opposed to the other webinars. We have a guest speaker. But today we decided, hey, Miki Jo, Resto is going to be our guest speaker because not only is Miki Jo our head of client engagement, she also has her own coaching and wellness business called Imagine Your Health. So this is an area of expertise when we talk about employee health and wellness, but we're also going to talk about employee resilience because as we are making these changes, we have to recognize this is causing stress in the organization. And it's causing stress not just for those of us that are affecting this change, but it's also causing stress for all the employees wondering what the change is and what does it mean for them. And so Miki Jo has created this comprehensive tool to really help you focus on employee health and wellness and resiliency as it relates to returning to the workplace. So I'm going to spend, if you've attended this webinar before, I'm going to spend less time today talking through the tools, and we're going to spend more time in the Q&A with Miki Jo so we have an opportunity to get into the meat of the tool. And that's what really is happening. So when we talked about the roadmap, when we talk about a change management plan, we start with planning and preparation. And now we're seeing more and more of our clients and our community coming back to work. So now we're going down that roadmap. We're actually implementing these tools and these plans we put in place. So that's the beginning of today. We're going to, and ongoing, we're going to talk more and more about implementation and learning from each other of how this implements. So none of this webinar happens, though, without my team. And so we have Renee Maurer, who is head of operations, as well as Amy Watson, who oversees our administration and consultant engagement. Today is special because it is Renee's birthday. So happy birthday, Renee. I'm not going to sing it and embarrass you or myself, really embarrass more me. So with that, Miki Jo is in control of this PowerPoint today. I don't have the control because of a little bit of a technical glitch we have. So if you want to advance, Miki Jo, that would be great.
Yeah. So because this just happened, I just will ask Brennan, if you can just go like this every time, and that way you don't have to ask me. And also,
I will do that.
Great. And I just wanted to let everybody know on the webinar that we don't use chat. What we use is Q&A. So after Brennan goes through the initial roadmap tools and decision flow tools, then we'll do some Q&A on those. So if you have any questions, go ahead and put them in the Q&A and we'll get to them at that point. And then after we go through the health, safety, and resiliency piece, you can just keep putting your questions in and we'll get to them during that section. So that's how we'll handle that.
Great.
Okay.
So here's my first signal.
Yes, and just so everybody knows, we have not had these technical difficulties yet before, and now I can't seem to get it. Oh, there we go. Okay.
There we go. Yeah, it's a little unique. So just very quickly, I'm going to do 10 seconds about us being Bright Talent. Then we're going to get into assumptions. We're going to talk about planning. We're going to talk about the tools, the collaboration tools, and then we'll jump into the Q&A. And as I mentioned, all of these tools are more or less a DIY approach, do-it-yourself approach. At Bright Talent, we are here to help you. So if you need help developing these tools, on the pandemic support page, we have built packages to help you in terms of consulting packages that are affordable. So if you need help developing or implementing, we can do that for you. We've also created a live chat service. So if you need help on a temporary basis or long-term basis, communicating with your employees, we have trained HR people behind the live chat that we can sit on top of your employee portal and help you move through this process of bringing your employees back to work. And we can help you through live chat, and we'd be happy to talk to you more about that. So if you can, I know I use my hands a lot, Miki Jo, so maybe move forward. Oop, go back one. So just very quickly, what we do is we provide responsive and resourceful experts in HR and other assorted disciplines. And we are a company that really operate through our values. So we provide honest solutions, we do what's right, we are resourceful, we are accountable, and we are about community. And that's what this entire webinar series is about, is giving back to our community that has so generously given to us through the years. So thank you for that. And we're just excited to be able to share these tools with you. So what we're going to cover today is assumptions based upon today's data. So as you know, this is constantly changing. So this is based upon today's data. What we're going to focus on is a project plan in terms of how to organize and get ready for the workforce to come back or even continue to come back. We're going to continue to improve it. We're going to share some collaboration tools that you can use so you can work with business leaders as you set up the plan. And then we've got some decision workflows we're going to talk through as it relates to your employees, how you can segment your employees so you can organize as to who's coming back versus who's working or who's not. And then what we're not going to cover today is any of the leave of absences, any of the emergency acts, any of the compliance or employment laws surrounding all this. This is more operations and strategy oriented. And so this is a little bit of the old data. We're already past early May, obviously. And so now we are here. We are implementing these plans. We are coming back to work. And so I've been talking to a lot of different HR leaders, a lot of people like you in terms of how it's going. And as expected, it is mixed. And so we're a little bit all over the place. So I just want to make sure all of you realize no matter where you are, we're all in the same place. So it might sound to you as you read different things that some people are ahead of you, some people might be behind you. I think we're all doing some things well and other things we can have opportunities to improve. So don't feel like you're behind the eight ball. We're all learning on the fly. And so when we talk about preparing for the new workplace, there's a couple things you got to keep in mind. We don't know when this pandemic's going to end, so we have to plan for it for the long haul. Obviously, this has exposed gaps for most of us in terms of our workforce plans, in terms of being prepared for something like this. And so therefore, it's time to now plan for this new reality and implement all these new practices. So this is an important slide in terms of assumptions and how we need to think about the overarching plan. So we were going to have distancing restrictions probably for a while. That means we have to think about how that relates to office adjustments in terms of how many people you can have in a room, how many people can sit side by side being 6 feet apart. We're going to have gathering restrictions. So similar to manufacturing or production businesses, we're going to have multiple shifts where perhaps professional employees are going to have shifts where some work on site some days and off site the other. Maybe they have an early shift, a late shift, so that we can work around the gathering restrictions, let's say of no more than 10 people in a room. We have employee health restrictions. So those that are 65 plus or immune compromised, they're in the high risk category. So now we have to figure out, what do we do with this employee population? And then the big topic right now is employee health screening. We need to check for temperatures. We need to do symptom checks. How do we do that? What is the best way to execute that? And I'll share a little bit more when we get into Miki Jo's detailed tool. In terms of infectious prevention measures, so what happens if someone tests COVID in the workplace? What is the action plan? How do we respond? And then many of us went into a remote workforce situation, and we didn't even have the policies in place, or our policies haven't been reviewed for a while. So we need to make sure we set up the policies to align with this new remote workforce. And so the best way to get all of this categorized and organized is to build a project plan. And for us, we thought there was 6 categories we would have to get structure around. 1 is policy, 2 is communications, 3 is function. So how are we actually designing this plan by function? Then what are the system requirements? And then what are the facility requirements by function? And then ongoing in terms of what are the continuous improvements. And the thing you're going to hear me say is, today we are operating crudely and effectively, not polished and perfect, because these plans are changing. You don't have time for anything pretty. Your policies are probably going to look like bullet points, and that's okay. Employees don't need narrative. They just need strict instruction and direction. So just realize, any of you that have the perfectionism disease like I do, we have to give that up and just be crude and effective as we develop these and implement these. So now we're going to jump into the project plan. And this is Microsoft Project, which is a wonderful tool. If you do not have Microsoft Project, you could build a plan like this in Excel. However, Microsoft Project really allows you to put in primary tasks and subtasks, add dates, and somewhat like building formulas in Excel, it has formulas built in, so it just automatically adjusts dates and things. So it's a great tool if you don't have it. And so what I'm going to do is walk through a couple of views of this page because it's pretty small. And for those of you that are on a phone right now, I apologize, this will look tiny. You can go to our website and download this and follow along if you'd like. But if you look at the 3rd line, this gives you the detailed view for policies. And underneath policies, you will see draft or review return to workplace policy. And underneath that, you're going to see draft or review existing return to work policies. So let me clarify. Most of us have return to work policies when somebody goes on leave and comes back. What most of us don't have is a return to workplace policy, which requires collaboration with all of your department heads. So many of you are probably already doing this, but when we talk about policy, we need to think about return to workplace policies, which could be temporary, and then return to work policies. And you'll be collaborating with your peers to structure that appropriately for each department or function. So next page. In parallel, as you are reviewing the policies, you also have to be thinking about communications. So when we think about communications, we need to develop a communication plan as to how frequently are we going to communicate to our employee base, and how are we going to communicate to them, and who are we communicating to them? Because you're going to have different audiences. You're going to have all employees, and then more than likely you're going to have by function. So we have to organize a plan as to how frequently we're going to communicate, build those messages, and then get those messages out. And more than likely, the first message you are going to get out is going to be the very fact that you've built this plan and you're executing against this plan. And so moving to the next one, and then we move down to function. And then we essentially start working with each leader, department leader, functional leader, to build out the plan for each function as it relates to how does their employees come back, what are their individual needs. Next one. And as we uncover the individual needs for each function, you're going to uncover systems needs and requirements. It might already be in place, it might be fine, but if we start changing into a hoteling situation where employees are coming back for just a day at a time and they don't have a dedicated office, what kind of new systems are they going to need for that? Or if they're working remotely and perhaps you weren't set up with a secure system to handle that, what upgrades are you now going to make so people can work securely from a home office or just a remote office? Next one. Facilities is the next one, and this is probably one of the larger ones we're dealing with right now. And if you are blessed with a facilities manager or environmental health and safety manager, that's a great partner to have. Is you figure out what are the necessary things you need to do to make the changes in the facilities. But this helps you think through not just the facility by the department in terms of department needs, but also all the communal areas, break rooms, bathrooms, kitchens. What are the gathering restrictions? How many people are we allowing at a time? What are the sanitation instructions so that when they're touching the refrigerator handle, they have to clean that off and make sure we have the disinfectant and the towels to do that for employees. And so we need to be prepared for the facilities. If you don't have a facilities leader or a manager or environmental health and safety, you will want to pay close attention to Miki Jo's tool today because it walks you through all those necessary things. And then as it relates to the workforce itself, we have to look at a macro level, which is by function. What are we doing with our employees on a macro level? And then we have to look at it from a micro level. What are we doing by individual employee? So let me just walk you through this very quickly. So we start at the top, and it's the functional workforce. So let's just call this the IT department. And then we come down, are they returning to the workplace or not? And let's follow the path to the right. If the answer is no, they're going to remain a remote employee. And then we come down, and the next big question lately has been, are they on leave or not? And if they're on leave, then we continue that path, yes, on leave, go to your normal leave policy. If they're not on leave and they're able to work, then we go down and we build, sorry, that got it through me. We start making sure that our remote work policy is in place. We define the requirements. We communicate that with the employee in terms of what the requirements are. We come down further. We make the updates to our remote policy. We communicate that with the employee, and then we continually evaluate for ongoing improvements and changes. So that's the path for somebody that's able to work and be working remotely. If we go back to the top and we look at our function and are they returning to the workplace, yes, now we're moving to the left, so they're a workplace employee. So once again, are they on leave or not? And then if they're not and they're able to come back to the work and in the workplace, then we're going to get into the requirements that are necessary to train them on by returning to the workplace. And that little sub box that I have to the right, the workplace needs, these are all more or less reiterating the same things I just shared with you in the project plan. Who are you partnering with in terms of facilities, IT, and defining all those needs for them? And you just work through that process again. And a tip at the bottom is office supplies now are going to require PPE, meaning face masks, sanitation, hand sanitizer stations. So these are things now we have to offer to our employees as they're walking in the door. And so as the requirements get defined and communicated, we work down, and again, once again, we're always evaluating and improving. And so that's what it looks like from a functional employee breakout in terms of how you're going to organize your employees. Moving to the micro level, which is by employee. So if you want to advance to the next slide. So if we look at it by employee, we see the first question is, are they able to work? And if it's no, then we move to the leave policy. If they're able to work, then we move left. And the next question is, are they returning to the workplace? If the answer is no, if the answer is yes, we move to the right. And we just go through the same flow we walk through for the functional workforce. If the answer is no, meaning they are going to work remotely, assuming they're able to work remotely, we come to the next question. They are not returning to the workplace. Are they able to work remotely? If the answer is yes, we work through the same workflow we just walked through for the functional view. Here's where it gets tricky. If they are unable to come back to the workplace, and if they are unable to work remotely, we have to evaluate the employee status. Are we changing their job? Are we going to retain them? Then you move to the right and you figure out what they're going to be doing. If they are unable to work remotely and unable to come back to the workplace, then we really need to figure out what's going on. Are they furloughed? Are they laid off? Are they on some kind of disability or extended leave? And so that's how you have to look at your workforce in this level of detail in this organization. And then moving forward, the next document you'll find online is our project plan, which is a detailed project plan, which really is in support of it's project plan outline, which is in support of the project plan. And if you could advance one more, I'm not going to go in this in detail. However, you can see that it's supporting the project plan and in greater detail, but it also has all of the links you will need to develop your policies and practice. It takes you to all the necessary government agencies. It even recommends OSHA, recommends SHRM. If you're a member of SHRM, SHRM's had amazing resources to help you get set up. So those are the 3 documents we have prepared for you so that you can plan and implement into the workplace. So people are now implementing now. So all those things that we were just talking about, they are now being implemented in the workplace. And it can't be perfect. You're implementing and you're learning on the go. And that's one of the key communication things you need to have for your employees is expect this to be imperfect and expect changes frequently in terms of how we're going to operate as we learn. So Miki Jo, if you want to move to the Q&A slide. Now, this slide has all the necessary links that were just stated in that project plan outline, except for a couple of additional ones I want to point out. On the resources page on our pandemic support website, it has all these links. And these links at the bottom, Casco Back to Work specifically talks about facilities. Fisher Phillips specifically talks about healthcare questionnaires. And then what Miki Jo is going to go over, we have this employee health and wellness resilience tool that she's going to go over today, and that's on her website, healthasaresource.com. So with that, Miki Jo, we're going to have fun today. We're going to swap roles, but before we swap roles, was there any questions before I start asking you questions?
Yeah, good. There are. Here's one, and I'm just looking at them now because I didn't want to look at them and advance your slide. So
sure.
How do you force someone to go home if you think they're sick? Can you force someone to do temp checks? Do they have any, and this is all one question,
Yes.
Do they have any rights regarding this, or what are their rights?
So their rights are during a pandemic that they have no rights if they're, I guess said that facetiously, the employer is in full authority to ask the person to leave. Yeah, I know. Of course they have rights. But no, the employer is in full authority to ask them to go home, ask them to leave the facility because it's about protecting the greater good than one individual. As it relates to how you want to compensate them, that is something I think you need to figure out what is fair between you and the employee.
Yeah. Okay, good. Next one. Does contracting COVID-19 constitute having a disability under the ADA, the Americans with Disability Act?
So here's how I'll speak to this. I won't speak to it in detail, and I'm not an authority on this. However, this is what I've learned. So what I've learned is I do not know if COVID-19 is actually considered ADA protected disability or considered, but the effects of the COVID-19 on the body, whether it's a long-term respiratory ailment and such. So that could create a disability. So if it's somebody that had pre-existing condition like asthma, it just exacerbates that, and then now they can't come back to work. So the short answer is yes, it's not so much COVID-19, and that's probably going to change. So not so much COVID-19, but it's the impact of having the disease on the body that could be the disability.
Yeah, so I agree with that. The answer is yes, it's a possibility, but that we need to look into it on an individual basis, right?
Yeah, and what's so important, and just real quickly, there was an executive order by Governor Newsom that came out last week or 2 weeks ago that said COVID-19 was now could be a workplace injury and be covered by workers' comp. Of course, for most employers, that kind of all stopped us in our tracks. There was further guidance on what that meant. So this is correlating to the question. If a person has COVID-19, they have to show that they were tested and tested positively by a qualified physician or qualified facility, and then they have to have a physician's note as to when they are cleared of COVID-19 before they come back to work. So there are stipulations and guidelines in place for a person to qualify for these different situations, I guess I'm going to call them, that requires disability verification.
Yeah, and let's think about that. Let's move forward, kind of forward think about that. So now if I've gone back to work and I am able, and I get COVID-19, 2 weeks after I'm at work, basically they're saying that it's on the employer to show that they have all of these policies and procedures in place so that it was possibly unlikely that the employee got it at the workplace. But you have to have all those things in place. And we're talking to HR leaders here, and that's why we're talking about it from the company perspective. There's an employee perspective as well, but it's on the onerous of the company here in California, especially. At least that's what we're talking about right now. It'll be on the company's owners to show that they have all of the procedures and things in place.
So Miki Jo, oh, sorry.
I was going to say, and also, if you should, for some reason, if your company should get sued, then that book of defense, let's call all the policies and procedures a book of defense, that'll be very important.
Yes. So I was able to pull up the Q&A here. So I'm going to pull an audible. I'm going to shift now and take over the moderation, but I'm going to answer this one question. If one of our employees is quarantined, what information can we share with our employees? This has come up before, so let me give this guidance based upon what I've heard from others. So if a person's sick, we start teetering into the area of HIPAA, right? So that's private information. However, if it's COVID-19, it is important that we understand who was standing within 6 feet of that individual. So if there was anyone that they were working along with standing within 6 feet of that individual throughout a day or 2 days, or where they went inside the facility and who they we need to let those people know that they were potentially exposed to COVID-19. And so they should be self-isolating, not coming back to work. Generally 2 weeks is the number, to make sure they don't come down with any symptoms. And what I feel a best practice is, you could disagree with me, but what I feel a best practice is, you can communicate with all the employees of that specific location, because what you don't want is rumors and hearsay and false information spreading. So if you have had a employee come down with COVID-19, you handle the most immediate people around them, and then I think it's important to let the employees know in that specific location or building that there was somebody with COVID-19, and there should be some element of sanitation that happens as well. So it's important to communicate to your employee base what is happening. So if somebody had it, this is the steps we're taking to clean the area and make it safe for everybody. So that's part of that employee communication that needs to happen. And then there's another question here. Can we set up a team to help write policies that we can share with the group? I'm not sure I understand that question entirely. So if you were saying your own company, is there a team to help write policies that we can share with the group? The short answer is yes, of course. You would want a cross-functional team to help write these policies. If you're saying that to us, meaning like the general HR community, to build some standards, I think that's a pretty interesting question, because I don't think there's any standards right now. So the short answer would be on that, yeah, we would love to participate in that. In fact, that's probably a great idea. is if we can build some standards. But where we're seeing standards come from is some of the employment attorneys, which is probably the safer place for it to come from. But in terms of some more of the operational stuff, like we're saying, there could be some SOPs we could create. So sorry, you made my creative brain go, and I appreciate the question. So hopefully that answered it. So now let me flip and become the moderator and introduce our next guest, our guest, Miki Jo Resto, who we know at Bright Talent so well. But Miki Jo is an expert in health and wellness. And Miki Jo, you have been doing this now for how long? The coaching and the health and wellness and the ongoing education and certification.
I would say I've had a parallel career. So that's a good question. One whole track of my career is, as everybody here knows, has been hiring, talent management, performance, succession, all of the talent management side of HR, as well as change management and HR transformation. And along that way, all these years, I've been studying health and wellness and transformation. You know, I think we all have a personal journey. So early on in my life, that was for me. I lost both of my parents. I lost my mother when I was 25 and my father when I was 30. So I've always held this question of why and how can it be different? And I'm people oriented, and my mission is to help people. And I think that's probably not too unlike everybody that's joining us right now. Because a lot of reasons, that's why we end up in HR or some side of HR, right? And then, but when I was a leader inside, I wasn't in the health and wellness aspect in the company, but I have, for like 20 years now, I've been a coach, and I've been doing a lot of let's say, stress management and stress transformation for all those years. And about 7 years ago, I turned that into a company called Imagine Your Health, where I work with leaders and entrepreneurs, and I work with a lot of HR leaders and in hiring, and really focus on a blend of, okay, how can we be more well and more resilient at work, number one, so that we really enjoy work, but also so that we're performing our best and bringing all of ourself that we want to fulfill ourself at work. So fulfilling our performance for the company and fulfilling ourself. So this pandemic has brought both of those things together.
Right.
Yeah.
And I was just going to say, we have a question, and I think it's a great lead-in. I believe you're going to show us the tool that you've created, right?
Yeah.
So you can kind of walk us through it. But I think the question, and it's a perfect lead-in, what do you recommend for those who are feeling stressed and scared to come into work, but their manager is saying that they have to come in? So I think your tool is going to help answer how we get managers trained to be, I don't know if empathetic is possible, perhaps, fake it till you make it, at least help them with a checklist of what they need to know, and at the same time, what we need to be doing for all of our employees.
Yeah. So I'm going to have to stop sharing for just a moment here so that I can open my tool.
Yep.
Just to let you know what's going on. And when I have it up, I will go back to sharing. Oh, okay, now I will share again. And here we go.
And while you pull that up, I'll just let you know, we got the answer to the question about the operational question, and it is on a more community-based, HR-based, building SOPs for it. I think it's a brilliant question. And the person that's asking it, let's follow up afterwards and see if we can collaborate on that. We obviously have a lot of people now in the 6 weeks we've done this that would probably love to participate as well.
So there's two sides to two sides of responsibility to staying healthy and safe and resilient at work. There's the responsibility of the employer and there's the responsibility of me as an employee, so me as an individual. And so what I wanted to do was build a tool and a toolkit, just so you know that everybody will be able to get into this toolkit that has a plethora of tools for both sides. But what I want to show you right now is the master tool for the employer side. And so this brings together planning and implementation for the workplace health and safety, which in kind of a reverse engineer way will actually help you with your policies and procedures. And then a couple of tools for increasing employee awareness of personal health, and actually just by taking these questionnaires can help them learn what the factors of resiliency is. So in the tool, you'll get this page, which is roles and responsibilities of human resources, the internal communication, management, and employee. So that's all built out for you. And it's not that you're not already thinking about all of this already, but think of this as kind of a gap check. What are we not thinking of, or what area do we need to drill down into the details that we haven't yet? So it's more just as a support piece. So there's there's about 4 questionnaires here for you. Here's a sample COVID-19 symptoms questionnaire, and it actually comes with permission from Fisher Phillips. And so you see that it's copyrighted by Fisher Phillips. This is a sample, but it should be able to help you both with staffers and with shift workers. Here is a health safety observation tour for managers or anybody in the department who is trained to do it, because I'm sure there'll be a team of people assigned to these observational tours. And this will go through observations of what's happening or all the policies and procedures being observed, as well as a knowledge check that you can do with different people in the department to make sure everybody feels and can actually demonstrate how to put on masks, how long the social distancing is, all of that. Because we can assume that we all know, we've all been living this together, but what keeps people safe is actually asking the questions and doing the observation tours. Then here's where we have the employee part come in. So as an employee, if you as an employer make it accessible for me, I can download and take this health self-check. And I might add that the company shouldn't be there when they're taking this. This would be HIPAA covered information. So the employee can either print it and take it themselves, or if an employer decides we really want to understand what's going on kind of more at a detailed level of health of our employees, we can provide a HIPAA compliant system where you can get some aggregate and anonymous information. But the purpose of this is really just to make it available to the employee, and you can see this has, if you look to the left, this has all the different kind of drill downs into your health. And I won't, even into prescribed treatments, are you actually taking your medicines if you have prescriptions and things like that? Then we go to the next one, which is a self-check, and this is about resiliency. I'm just going to touch on this right now, and then if you have more questions, we can come back to it. But on the left side, you'll see the factors that we need to think about in terms of resiliency on the left-hand side there. So I don't know why that keeps coming up today, my apologies. Now we're going to go to the planning gap checklist, and this is built for your organization. We have drill down checklists for supply planning and all the different locations that needs to be done for. Worksite entry planning, which you're already thinking through, but here's something to make sure that you're thinking through all the different levels of that. Distancing and disinfectant planning. So no more needs to be said about there, but really what it's doing is breaking out location areas again for you. And you and your team can decide, we've completed thought and procedures for every one of these areas, what's incomplete, what needs to be updated, because there's changes that need to be made, both sometimes from a facility point of view, how many employees are coming back to work, but also CDC recommendations. So there will be changes. Distance visuals planning. So this is about the signage, floor tape, everything that we need to see to remind us to keep safe. Like when we all started wearing masks, a lot of our masks aren't N95 compliant, right? But we're wearing them to help keep others safe in case we're a carrier. But also they said, hey, this is a reminder. So those visuals reminders are important. We have a materials resource checklist for you. And you can see that there's documents, signs and announcements, standards and instructions, and then some things for HR only. Now, it doesn't mean that this list has all of the answers or the exact right place that you always need to go. But what you can do is research it if you need answers, and you can keep a resource, all of your resources here if they're not already there. And then really importantly, in HR, we're always wondering, how are we going to communicate this? And are we doing it right? Are we doing it strategically? And who all needs to be involved? So this communication and endorsement planning is it's the whole enchilada, everything you need to think about. So the roles, again, of internal communication, human resources and facilities, management, and all employees. And we forget, we're employees too, right? We are HR and we're employees. So just keeping that in mind. And then the communications for the worksite entry, disinfection, physical distancing, health and resilience and awareness. Again, blending in, and this is what a lot of, if you see other tools, what they don't tend to do is bring in the employee responsibility side of it. So that's why health and resilience awareness is in here, and the endorsement. And again, you see information all the way across. So that means in almost every one of these, and the training obviously is very important. The training, I can't say enough about how important it is, even though it's going to be very simple training. HR needs to be trained, managers will need to be trained, employees in small groups, I would recommend being trained so that we can observe that they actually know and are understanding how to wear their PPE equipment.
So Miki Jo, yeah. I just want to do a time check really quick. This is such a detailed document. And just to give my endorsement, you know, this is the culmination of obviously Miki Jo's expertise, but it's also the culmination of other tools that we've been given through the last 6 weeks, and we've all learned together. And so Miki Jo has taken the time to combine a lot of great thinking into this tool so that you don't have to. So it makes it really easy.
Yeah, and I'm going to say that Brennan had a lot to do with this. So this wasn't me making this up in a vacuum. We're all about best practices, right? So we as in Bright Talent and Imagine Your Health, and I'm going to mention Jennifer Newton, who is also part of Imagine Your Health. We've been looking out at all of this, and like Brennan said, we've tried to combine some of the best of what we've seen.
So we do have a question. Actually, I want to revisit the first question, but we have a new question that's come in. So here's what, and I think it's an excellent one, and you're the perfect person to answer this. Once an employee goes through the questionnaire and has a general understanding of where they are with their mental state, are there any recommendations on what they can do with it to improve? So if they are feeling stressed, or if they're feeling fearful, and you know, they're just, and even if they do come into the office, maybe they're not operating at their best because they're just, you know, off their game, as they could say. What's the recommendation there in terms of what they can do with it?
Well, I love that question.
To improve.
Yeah, no, I love that question because it is the question that, one of the questions that brings in the employee and the health safety piece, right? So I just came over here because I wanted to see what you have access to. This is free. These are free premium resource tools. That health and safety planning tool that I just went over, when you click on this here, it will take you there. You'll also get PDFs and Word docs. So you'll get them in all the forms you need in order to actually be able to use them. When we're talking about, I'm nervous to come to work, or, I'm having various feelings, I'm providing what's called, or Imagine Your Health, and Jennifer Newton is part of this as well, we're providing resilience and well-being toolkit. And when you go into that, there's 3 levels really of taking care of ourselves, of accessing our resilience and building a foundation for resilience. And when I say resilience, I don't want to mean just, oh my gosh, I'm getting through another day. I'm really talking about how can I transform this stress? How can I transform this feeling? Really, how can I gain energy instead of feel nervous or drained? And so there's 3 areas of tools here that you can use. You can use them as HR leaders yourself. You can share them with your company, however you see fit. But one is to tap into your inner resources for transforming stress. And this has 3 tools in it for you that these are more discovery tools and exercises that help you truly access your positivity, helps you create a breakthrough when, let's say, you keep going back and you're experiencing something that you're really wanting to shift. So there's a tool to create a breakthrough in there, and then there's a tool to actually it's a self-awareness tool to get even more aware of when does this begin and how early can I start shifting these things. So this is the mental part of resilience. And then we have discovering your calm center, rediscovering a calm center and to feel expansive. This is about heart-brain coherence. So it has some breathing, it has some meditations in there for you, and it has another awareness discovery guide. But this is all to help you come back to center. So it's not that we think you're going to be taking a ton of time for these tools or whatever. It even has an interview that really explains heart-brain coherence. But when we build that's when we can stay into that positivity for longer periods of time. And then eating a rainbow to grow stronger. Of course, I have to touch on food. And this is not complicated food stuff. I want you to know that. This is fun, colorful, and easy, but with awareness. So those are 3 ways to be able to help yourself access some well-being, calm, and resilience.
I think that's a great point because, so many of us might have an 800 number for somebody that's having a mental health issue to call that number. Some of us might not. And so now you're providing these tools, not just for us, but also potentially to share with our employees if they are feeling stressed. And I think it's also important, going back to that initial question about the person's feeling stressed, they really don't want to come in, but the manager's saying they have to come in. So potentially this is some information you can share with the manager to let them know this is an extraordinary period of time for everybody and that we need to be more flexible. But there are also some operating procedures we do have to put in place, such as, if they are unable to overcome their fear and they're unable to come back to work, and I'm not asking this question of you, Miki Jo, I'm just saying in a general term for the group, there's got to be some, unfortunately, this might sound harsh, but some stakes in the ground where if they're unable to work, then there's something far greater happening here. And then we have to start looking at it as job abandonment's kind of harsh, but at least perhaps some mental health issue that's causing a disability. So we'd start going down the path of leave then in that regard. But these tools are fantastic to try to get them back to center, as you said.
Yeah. You can, before we decide that, there's something in between, right? You can, if your company allows you can help get them a coach for a brief period of time. Either a performance coach or a health performance coach like me. I do both sides, but right. One of the companies that we were talking about the other day, Brennan, said that they were giving employees 90 days, which is a very generous amount of time. But in that 90 days, are they are they making either some suggestions, or are they helping them to bridge that gap, you know?
Sure.
Yeah.
Sure. I want to be sensitive to time. It's 11:50.
Yeah.
We do have one question, somewhat related. They said they can't find this on the website. Let me be clear. This toolkit right now, that Miki Jo just walked you through, is not in the pandemic support, I believe. There's a link to the toolkit she just showed you, which takes you to this website. To get to this specific website, well, we will add it to our pandemic support if it's not there. But it is
there.
Health is a resource. Okay, it is there.
It is there. It's
Excellent.
under I'm sorry, the link says Imagine Your Health. Renee posted it yesterday. Thank you, Renee. And it's under the additional resources. So go to Brightown pandemic page. It's under additional resources and Imagine Your Health. And in the follow-up email, I'll provide you a direct link.
Perfect. So we're just about out of time. I don't see any other questions here. I just want to say thank you, Miki Jo, and I know Jennifer also, who's on the webinar too, who has been a participant in this in regards to her development. Thank you all for joining us. This is a big conversation. I'm sure we'll have more about this. We are going to again be doing this next Friday, and we will be identifying another guest to come in and speak. But right now, again, we're in this implementation phase. Feel free to reach out to us if you have questions. We are here as a resource for you. And I apologize. I think another question came in right when I was talking. Okay, somebody just responded to that last question. So please come back next Friday, because we are adjusting our material to move down that road in terms of implementation. So thank you, Miki Jo. Awesome job. That toolkit is phenomenal work, and I'm so grateful we can pass that on to everybody here. And then we hope to see you next Friday, and everybody have a wonderful Memorial weekend.
Thank you so much, everybody. Have a great weekend. Talk to you later.
Bye.